Good morning, everyone. Hello, welcome to Health Breakdown. Thank you for being here today. I want to talk about something that may sound simple, but has a profound impact on the health, independence, and quality of life of our beloved seniors. It's about something as ordinary as climbing a flight of stairs, a task that many take for granted, but one that becomes a daily challenge for millions of older adults. Now, what if I told you that one major reason seniors struggle with this basic movement could be traced back to a single vitamin deficiency? Yes, I'm talking about vitamin D, the sunshine vitamin. Vitamin D deficiency is a widespread issue among seniors, affecting millions of older adults worldwide. As people age, their bodies undergo many physiological changes, and one of the most significant is the reduced ability to synthesize vitamin D. The skin's natural capacity to produce vitamin D from sunlight decreases significantly with age. In fact, a 70-year-old person produces about 75% less vitamin D from sun exposure compared to a younger adult. This decline alone puts seniors at a high risk for deficiency, even if they spend time outdoors. Additionally, lifestyle factors contribute to the problem. Many older adults are less mobile and may spend the majority of their time indoors, especially those living in assisted living facilities or nursing homes. This limited sun exposure is compounded by the fact that seniors often wear more clothing, use sunscreen, or avoid the sun altogether due to concerns about skin cancer or other health conditions. Even geographic location plays a role. Seniors living in colder or cloudier regions may go for months without adequate sunlight, further increasing their risk of deficiency. Dietary intake is another critical factor. Vitamin D is naturally present in very few foods, mainly fatty fish like salmon or mackerel, and in fortified products like milk, orange juice, and cereals. However, older adults may eat less overall, have dietary restrictions, or struggle with poor appetite due to medication side effects or other health issues. Malabsorption disorders, which become more common with age, can also reduce the body's ability to absorb vitamin D from food, even when it is present in the diet. There's also the issue of impaired kidney function, which tends to decline with age. The kidneys play a vital role in converting vitamin D into its active form, calcitriol, which the body needs for various functions, including muscle strength and bone health. Without this conversion process, even adequate levels of vitamin D in the blood may not be sufficient to support good health. Seniors with chronic kidney disease are especially vulnerable in this regard. Despite all of these risks, vitamin D deficiency often goes unnoticed in older adults. The symptoms, such as fatigue, muscle weakness, joint pain, and increased falls, are frequently mistaken for normal aging. This misattribution can delay diagnosis and treatment, allowing the deficiency to worsen over time and lead to serious consequences like osteoporosis, fractures, loss of mobility, and diminished quality of life. Routine screening for vitamin D levels is not universally practiced, which means many seniors remain undiagnosed. However, simple blood tests can detect low levels, and once identified, the condition is generally easy to treat with supplements, dietary adjustments, and controlled sun exposure. Public awareness and proactive healthcare can make a huge difference. Understanding how common and impactful vitamin D deficiency is among seniors is the first step toward preventing many mobility-related problems, including the inability to perform basic daily tasks like climbing stairs. By addressing this deficiency early, we can help seniors maintain strength, independence, and a better quality of life. Vitamin D plays a critical role in maintaining muscle strength and balance, especially in older adults. While it is commonly associated with bone health, its impact on the muscular and neuromuscular systems is just as significant. One of the lesser known but vital functions of vitamin D is its role in muscle cell metabolism and function. It directly affects the health and performance of skeletal muscles, which are essential for everyday movements such as walking, standing up, and notably, climbing stairs. Vitamin D receptors are found in muscle tissue, and when vitamin D binds to these receptors, it promotes protein synthesis and muscle growth. This process is especially important in maintaining type Roman II muscle fibers, also known as fast twitch fibers, that are responsible for quick, powerful movements. These are the exact muscles needed for tasks like standing from a seated position or taking the first step up a staircase. In seniors, these fibers naturally decline with age, and a lack of vitamin D only accelerates this process. When vitamin D levels are insufficient, muscle weakness and reduced coordination often follow. This weakness tends to start in the proximal muscles, those located in the thighs, hips, and upper arms, which are crucial for mobility. As these muscles weaken, older adults begin to experience difficulty with balance and stability. They may struggle to rise from chairs, maintain proper posture, or catch themselves during a stumble. Over time, this not only limits independence but also increases the risk of falls and serious injuries. Scientific studies have demonstrated that vitamin D deficiency is associated with decreased muscle mass and strength. In clinical trials, seniors with low vitamin D levels performed worse in physical function tests, such as walking speed, balance assessments, and climbing ability. Conversely, supplementation in deficient individuals has been shown to improve muscle performance and reduce the frequency of falls, especially in those over the age of 65. Vitamin D also influences the nervous system's ability to control muscles. It supports the transmission of signals between the brain and muscles, enabling smoother and more coordinated movements. Deficiency in this area can lead to slower reaction times and delayed muscle responses, further increasing fall risk and impairing mobility. Balance is not just about muscle power. It's about the body's ability to sense and respond to changes in position and movement. Vitamin D supports the vestibular system in the inner ear and works in concert with the muscles and joints to maintain equilibrium. Without adequate levels, seniors may feel unsteady or dizzy, and tasks like walking or turning can become hazardous. The cumulative effect of all these factors, muscle weakness, impaired coordination, and poor balance, often leads to reduced physical activity. Seniors may begin to avoid stairs, long walks, or uneven surfaces out of fear of falling. This leads to further muscle atrophy and a cycle of declining mobility. Addressing vitamin D deficiency is a critical intervention that can help seniors retain their strength, balance, and confidence as they age. Loss of mobility in seniors is more than just a physical limitation. It sets off a chain reaction that impacts nearly every aspect of health and quality of life. What begins as a small difficulty, such as climbing stairs or walking long distances, can quickly evolve into a serious decline in overall well-being if not addressed. This domino effect is often underestimated, but it is one of the most critical issues facing older adults today. When a senior begins to struggle with mobility, they naturally start to limit their activities. Tasks that were once routine, like going to the grocery store, visiting friends, or participating in hobbies, become burdensome or even impossible. This leads to a more sedentary lifestyle, which in turn causes muscles to weaken further. The body thrives on movement, and without regular activity, muscle mass begins to shrink in a process called sarcopenia. This muscle loss not only makes movement harder, but also affects balance and coordination, significantly increasing the risk of falls. Falls are among the most serious consequences of mobility loss. For seniors, even a single fall can result in life-altering injuries such as hip fractures, which often require long hospital stays, surgery, and rehabilitation. Many never regain their previous level of independence afterward. In fact, after a major fall, some seniors become permanently reliant on walkers, wheelchairs, or caregiving assistance, and many are forced to move into assisted living or nursing homes. But the domino effect doesn't stop at physical consequences. Loss of mobility also affects mental health. As seniors withdraw from activities they once enjoyed, feelings of frustration, helplessness, and isolation begin to surface. Social connections weaken, and depression or anxiety can develop. The lack of physical activity also reduces the release of mood-enhancing chemicals like endorphins and serotonin, further deepening emotional distress. Cognitive health can also suffer. Physical movement is closely linked to brain function. Regular exercise improves circulation, increases oxygen to the brain, and stimulates the release of neurotrophic factors that protect against cognitive decline. When mobility decreases, these protective benefits are lost, potentially accelerating memory problems or the onset of conditions like dementia. Additionally, the loss of independence is a deeply emotional experience for seniors. Many older adults take great pride in being able to care for themselves. When they can no longer manage simple tasks like bathing, cooking, or getting dressed without help, it can lead to a diminished sense of identity and self-worth. What's important to understand is that this entire chain reaction can often be prevented or slowed with early intervention. Something as simple as correcting a vitamin D deficiency, encouraging gentle physical activity, or providing the right assistive devices can stop the first domino from falling. Once mobility is preserved, so too is the senior's dignity, independence, and quality of life. Addressing mobility loss early is not just about improving movement, it's about protecting the entire foundation of health and well-being in older age. The good news about vitamin D deficiency and its impact on mobility in seniors is that this problem is often preventable and treatable. Unlike some complex health conditions associated with aging, low vitamin D levels can be identified with a simple blood test and effectively managed with lifestyle changes and appropriate supplementation. The key is early awareness and proactive care. First and foremost, prevention begins with understanding the risk factors. Older adults are more prone to vitamin D deficiency due to a natural decline in their skin's ability to synthesize the vitamin from sunlight. They may also spend less time outdoors, have limited diets, or take medications that interfere with vitamin D metabolism. Recognizing these risks allows families and healthcare providers to act before symptoms like muscle weakness, balance issues, or falls begin to occur. Routine screening for vitamin D levels in older adults, especially those experiencing fatigue, frequent falls, or mobility issues, is a simple but powerful preventive measure. Unfortunately, this is not always standard practice, and many cases of deficiency go unnoticed. When tested, vitamin D deficiency is often revealed even in seniors who appear otherwise healthy. A proactive approach by physicians, caregivers, and family members can make a big difference by catching and addressing the deficiency early. Treatment of vitamin D deficiency is typically straightforward. In most cases, it involves taking an over-the-counter or prescription vitamin D supplement. The dosage depends on the severity of the deficiency and the individual's overall health. Once supplementation begins, improvements can often be seen within a few weeks to months, especially in muscle strength and energy levels. Combined with regular movement or physical therapy, seniors can regain function and reduce their risk of falling. In addition to supplements, safe sun exposure is another valuable source of vitamin D. Spending 10 to 30 minutes outside a few times a week, depending on skin tone and climate, can significantly boost vitamin D levels. It's important to balance sun exposure with skin cancer prevention, but moderate time in the sun, particularly on the arms and legs, can be beneficial. Diet also plays a role in both prevention and ongoing management. Encouraging a diet that includes vitamin D-rich foods such as fatty fish like salmon and sardines, egg yolks, mushrooms, and fortified dairy or plant-based milk can help maintain healthy levels. For seniors with dietary restrictions or malabsorption issues, fortified foods and supplements are even more essential. Physical activity complements vitamin D treatment by helping to rebuild muscle strength and coordination. Simple, low-impact exercises like walking, light resistance training, or Tai Chi can improve balance and overall mobility. When combined with adequate vitamin D, the benefits of exercise are enhanced, creating a positive cycle of strength, confidence, and independence. Ultimately, the fact that vitamin D deficiency is preventable and treatable offers hope. It shows that with the right attention and care, seniors don't have to accept declining mobility as a natural part of aging. Instead, they can take steps, often small but meaningful, to protect their strength, stability, and quality of life. Raising awareness about vitamin D deficiency and its effects on senior health is one of the most effective ways to protect aging populations from preventable decline. Many of the challenges seniors face, such as difficulty climbing stairs, chronic fatigue, muscle weakness, and frequent falls, are often accepted as normal aging. However, when people understand that some of these symptoms may be tied to something as simple as a vitamin D deficiency, they are empowered to take action. Awareness shifts the mindset from helplessness to possibility. A large part of the issue is that vitamin D deficiency is a silent condition. There are no dramatic symptoms that immediately indicate something is wrong, especially in the early stages. Seniors may just feel a little weaker, a little slower, or a little more unsteady than before. These small changes can be easily overlooked or dismissed by individuals, families, and even healthcare providers. This is why public education is so important. When people are informed that vitamin D plays a vital role in muscle strength, bone health, and balance, they can begin to ask the right questions and seek proper care. Community outreach and education efforts, such as seminars, health fairs, articles, and public service announcements, can help spread this crucial information. If seniors and their caregivers understand the importance of getting enough vitamin D, they are more likely to seek testing and take preventative measures. These could include making dietary adjustments, getting safe sun exposure, or starting supplements under medical guidance. Awareness is especially powerful when it leads to regular screening. When healthcare providers are alert to the prevalence of vitamin D deficiency in older adults, they can incorporate routine blood tests into annual checkups. Catching a deficiency early prevents it from progressing to the point where it significantly impacts mobility and independence. This proactive approach can lead to better outcomes and reduced healthcare costs, as it helps prevent falls, fractures, and the need for long-term care. Families also play a critical role. When adult children and caregivers are educated about the signs of vitamin D deficiency, they are more likely to notice changes in their loved ones, like hesitancy on stairs, increased fatigue, or difficulty rising from a chair, and seek help early. Raising awareness among caregivers and nursing staff in assisted living and long-term care facilities is equally important. These professionals are in a unique position to monitor seniors daily and implement preventive strategies. Increased public understanding of vitamin D's role can even influence policy. Government health agencies may be more inclined to fund screening programs, support nutrition education, or require vitamin D fortification in certain foods when the public demands it. Ultimately, awareness is the first step toward prevention and recovery. By talking openly about vitamin D and its connection to mobility and overall health, we can help seniors live longer, stronger, and more independent lives. It's a simple message with powerful potential, and one that could make a significant difference in the aging journey of millions.